Hello, my name is Saad Usmani. I'm the Chief of the Myeloma Service at Memorial Sloan Kettering Cancer Center. And on behalf of the CARTITUDE-1 investigators, I would like to present or share with you this abstract that our team presented at ASCO 2022 in Chicago, titled Phase 1b2 study of Cilta-Cabtagene autoleucel, a BCMA-directed CAR-T cell therapy in patients with relapsed refractory multiple myeloma. So this study has been presented by me and other colleagues, Tom Martin, Jesus Verdeja, as well as Deepu Madhuri in the past. And this particular update is a 2-year post last patient in follow-up. It's a landmark of follow-up of almost 28 months. The primary focus of this report is safety, because the overall response rate has been previously reported, a very high overall response rate of 98% in the 97 patients that were treated with the single dose of Cilta-Cel. These were median of 6 prior lines of therapy patients, high proportion being triple class refractory and anti-C38, PI and IMiD exposed and refractory. The key message, in this follow-up is, when we looked at the high-risk subgroups, such as high-risk cytogenetics or high tumor burden or extramedullary myeloma, all of those patients had responses in the range of 95 to 100%. But the duration of response and PFS and OS was shorter in the subgroups with high-risk cytogenetics and with ISS stage 3. The median PFS and OS for the whole population is still not reached. And amongst the 61 patients who were MRD valuable, 92% were MRD negative at 10 to the minus 5 at best response. And then, we do have patients who have sustained MRD negativity beyond 6 and 12 months, and those are the ones that have the best PFS and OS compared to the others. So no new treatment-related deaths. There were a total of 20 SPMs identified in 16 of the 97 patients. There were 9 patients who had a hematologic malignancy. 1 patient had a low-grade B-cell lymphoma. 6 had MDS. 3 had, AML. So, there was 1 patient who had both MDS as well as fatal AML. Then there were patients who had 6 non-melanoma skin cancers that were included in the 20 SPM number. There was 1 new case of signs and symptoms of Parkinsonism, which was contained and resolved. And that patient remains in stringent CR. No steroids or anti-cytokine therapies were given to that patient. So beyond that, there were no major updates. And Cilta-Cel is currently being utilized in CARTITUDE-2 study, which has reported some cohorts at ASCO and EHA. CARTITUDE-4 and 5 are ongoing, and the CARTITUDE-6 study is also underway. So, at a median follow-up of about 28 months, Cilta-Cel still has not reached its median PFS, and that's quite remarkable. Thank you.